And I think also for many people affected by ME, the idea of psychology playing a role is something really threatening to them, because they've had the experience of going on and something that can't be measured in the normal ways. And of course, for many years, doctors then saying, if we can't measure it in our way, then it must be all in your mind.
And then being told,
there's almost this reaction to patients of the mind-body link. But I know that from your experience working on the physical side, there is a very direct correlation between the mind and the body.
We often get told this, there is a psychological techniques, certain psychological techniques are profoundly effective in treating chronic fatigue. Not CBT in our experience, those kind of techniques are outdated, but some of the brief psychotherapies that have come about in the last 10 to 20 years have a profound impact on treating this illness, not because it's all in the person's head, because ME it's a mind-body event. It's happening, mind and body, the two things are connected, and what's going on emotionally and mentally impacts the physical body. That's what we find in our experience, and vice versa. So we're not saying this is in your head in any way, shape or form. We're saying that actually it's quite different. We're saying the two things are connected and you can treat both, and there is definitely a chronic stress trauma element that seems to be, in my experience, my opinion obviously, with my experience with all my patients, that is at a higher level in ME patients than, say, somebody with MS and so on. So so for all of those reasons, the medical profession hasn't picked up on this. It would need a paradigm shift in their approach to how they approach health and disease, and it's why it's fallen below the radar, and it's why we pick up on all that stuff, and how we approach it is using from those principles, if you like.
Yeah, and that's not just true, obviously, of the medical system. It's also true of alternative practitioners and that kind of thing as well, that people are looking for the one answer. And if we can treat this one bit, then it's going to impact the whole person. Yeah. What would you say about that?
So I often say when patients come and speak to us at the clinic in their 15-minute chats, and I've probably done about 3,000 15-minute chats in the last 4 years, and it's very informative because I've spoken to a huge array of different people with this illness, and you get to hear from them what's working and what doesn't work and what their experience is. And you've got specialists out there, people will know who've got the illness, that there's all sorts of different approaches. When people turn away from the medical orthodox approach because it hasn't been very helpful, and they turn to the world of CAM, it's confusing. Do you do acupuncture? What about massage? And then you've got all these specialists in ME that are saying it's all one thing. So we have specific groups in the ME specialist world, like we have the microbe group, where it's all about bacterial infection. You treat the bacterial infection, you can cure the illness. And then there are individual practitioners saying it's actually just thyroid and adrenals, and you have other groups saying no, ME is candida. You've got all this specialist, and then you've also got all the other things out there like acupuncture and the rest of it, which from speaking to 3,000 people, they might be nice things to have, but they're not very. From the impression that I get from speaking to all those people, they can be helpful, but rarely aren't really curative. And then you get people who speak and they say, well, I've had specialist experience where somebody's just working with ME. It might be the microbe group, or it might be the adrenal thyroid group, or it might be a structural imbalance. And you will hear patients who've had significant improvement in each of those areas. So they do make a difference. There are specialists out there there is no question, making a difference. The problem arises when they tend to start saying, this is what ME is, and it is the answer, capital T. And that's where it gets messy and destructive again, and confusing for patients, because if everybody's out there saying they have the answer, who do they believe? They can end up going through 10 different practitioners to find out which thing worked for them, because what's often happening is all these practitioners have a partial truth. They have a subgroup of ME people, yes, it's all about adrenal and thyroid. For another subgroup, it's all about a microbial infection, and if you treat that, that's the key. Very often it's more than one of these things going on in a patient, and they need this multifactorial approach.
And it also very much feeds into the standard idea that there is, you have an illness and you have the cure for an illness, and that's what patients I think often are looking for, and that's why they're so confused.
They kind of want a simplistic approach.